Now, a philosopher that we've spoken about quite a lot on this show, particularly in the episode on community, is Michel Foucault, and he has written extensively about the power dynamics that surround medical language. So in the 1960s, Foucault coined the term the medical gaze to describe the power dynamic that's occurring when we're using diagnostic language. He argued essentially that the speaker who is making the diagnosis is objectifying the patient, and he meant that in the very literal sense, that the person making the diagnosis comes to view the person that they are diagnosing not as a human being, but as a physical object upon which the various symptoms of the disease are displayed for those with a trained medical eye, for those who are well versed in medical language. And this part was like key to the oppressive nature of the medical gaze. So it's not just that the gaze itself is objectifying, that it establishes this unequal power dynamic between the patient and the doctor. It's that the doctor is not objective. It's that the doctor is not actually uncovering some like ultimate truth of disease that the body is revealing through physical symptoms. Rather, they are, for Foucault, more a kind of expert user of medical language, and they can read this onto the objectified body to decide how to interpret, understand, and ultimately treat it. The entire medical gaze, then, is filtered through and indeed created by medical language. So for Foucault, the main thing here is that medical language is a language of power because it carries with it an assumption of objectivity and rationality. This inherently places the user above the receiver because we assume that medicine itself is objective and rational. But is that assumption justified?